In recent times, we often come across the term weight management, obesity, different types of diets. So, doctor, what is your take on intermittent fasting?
Intermittent fasting is a very common term nowadays we are seeing. But as Siddha said many years before about this fasting, usually daily we can have this fasting up to 12 hours. Then intermittent fasting is one within 2 days or once in a week or 3 days a week. But as Siddha says, before sunset we have to stop our meal, and after a fasting of 12 hours only we should have our next meal. Then it has many benefits in present scenario. Because main of the diseases, lifestyle disorders are the result of this obesity. By diet, lifestyle, we can control this, and by intermittent fasting, daily fasting, we can regulate this lifestyle disorders. And in Siddha, we have medicines also, external and internal. But main reasons for this weight management, it's important.
So, doctor, how can we manage our weight?
We can manage weight by three, mainly considering three. One is diet, second is by knowing the underlying health conditions, and third is by lifestyle. Diet, we should have all that's proteins, carbohydrates, fat, fiber, but our carb intake should be very moderate or little. Our body does not need too much carb. Then second is lifestyle, maintaining a good sleep, exercise, bowel habits. And third is if we have to estimate if there is any underlying health conditions, mainly thyroid, PCOS. So we have to do blood test if there is a reason for this obesity. By maintaining all this, we can maintain weight. Weight management is possible.
So when we talk about the weight management, the first condition that comes to our mind is generally obesity, as madam has told before. So if you take the census, according to WHO, about 300 million people are clinically obese in this era.
Okay.
So it's quite a big question how you can manage. Once upon a time, before in olden days, this obese condition was quite seen only in case of rich people. Right now it is quite common. The common individual, it has become a lifestyle disorder. Okay, it's very common right now. So the prime thing is how you can manage your weight. So what is this obesity? What is your understanding in obesity is, what you should know is, when the body mass index, when you say about body mass index, how you calculate it is, you calculate the weight in kilograms divided by height in meter square. That is your body mass index. In case if it is more than 25, the person is considered to have overweight, or he is prone for obesity. And the prime line of management is, in order to reduce the weight, is the person has to undergo calorie deficit diet. I would like to explain it more. I would like to add a little bit more regarding that. When you talk about calorie deficit, what is actually calorie deficit? You see, when a person needs about 2000 calories for his basic metabolism. For example, if I am 80 kilos, my basic metabolic rate is about 2000 calories. Suppose, if I want to manage my weight, if I have to reduce my weight, I have to undergo calorie deficit. So what do you mean by this calorie deficit? 2000 is my daily requirement. I have to go for 1900 or 1800 per day. Okay, so it is a cumulative thing. You can't just cut off fat in 1 or 2 days. Whatever thing it is coming in the internet that you can reduce the fat in 1 week or 3 weeks, it's not going to happen. It's not a healthy way. Okay, so it is a cumulative process. You have to go in a slow and steady process for a healthy management of your weight. So Ayurvedic perspective, if you see the Ayurvedic perspective, in Acharyas, in ancient days, they have told that this calorie deficit, how beautifully they have told is, you see, the stomach can be divided into 4 parts. According to Ayurvedic perspective, I am telling, in which 2 parts you have to fill with solid food. 1 part you have to fill it with liquid food. And 1 part you have to keep it free. Generally, we will be telling you, don't take food till the end of your throat. You don't do like that. So you leave a little space. So that can be correlated here as calorie deficit. So that's what I would like to add on this area regarding obesity.
Okay. Doctor, what about your Siddha point of view?
Siddha system, Tirumala said that is food is medicine and medicine is food. But this weight management cannot be attained in just 1 month or 6 months. It is a regular process. We have to maintain a lifestyle from the beginning. But we want a strong willpower that we will do it and we will take it. So by actually maintaining a good diet, balanced diet, we can prevent this medicine intake. And by lifestyle also. This weight management is possible. But if we are having any underlying diseases like PCOS, we have to give some medicine for that along with this diet and exercise. And exercise is very important. Even brisk walking is enough. A morning and half an hour and evening and half an hour, because it actually combines with this exercise and diet only we can achieve this weight management. And only by little medicine PCOS can be completely cured. Fibroids, small fibroids, etc. can be cured with our medicines. We have very good medicines in Siddha and external treatment for this weight management.
Can you name a few?
Natte Chudi Parpam, Neerinil Kudineer. It can be given with a doctor's prescription for 15 days, then taking a gap. But the diet should be monitored very strictly.
So these are internal medications?
Yes, internal medications. External also we have treatment for this weight management.
Like what?
But external we have Tokkanam. With that body we are using a therapy.
It's a powder massage?
Yes, powder massage also we are, with medicated powders. So, but we have to maintain this diet for at least 6 to 8 months. And then only after that it will be achieved.
Okay. What about you, doctor?
Yeah. By Ayurvedic point of view, we have a management which is wonderfully mentioned in the classics. Say, the obesity, overweight can be categorized as sthaulya in Ayurvedic perspective, which is coming under something called as Sandarpana Janya Vyadhi. When you talk about Sandarpana Janya Vyadhi, it means that it is occurring because of excessive nourishment. So the first line of management is you have to subject the patient for a calorie deficit. That is dieting.
Diet.
Okay. So first you have to undergo dieting. The next is purification therapy. A purification therapy in the sense, you say, when I told you that the Sandarpana Janya Vyadhi, in this, according to Ayurveda, it happens because of the mismanagement of something called as Medo Dhatu. Medas. Generally we call it as Medas.
Okay.
So this Medas, which has undergone some pathology, it has to be corrected. For that, first the digestion should be proper.
Okay.
So for that, in order to make the digestion proper, the Agni, the digestive fire of the patient should be corrected first.
Okay.
So that is the first line of management. Then you go for purification therapy. First you manage the Agni of the patient, then you go for purification therapy, then you add on medicines and further treatments will be there. Each patient is unique. Even though the condition of obesity we categorize in a general form, each patient will be having the different sort of presenting complaints. So we have to look at the patient first, then we will have to manage. So this is the general line of treatment that I have to.
So normally can you recommend some Ayurvedic medications?
Yeah, definitely. One of the most popular drug that we use, a kashaya that we use, is Asanadi Kashaya.
Okay.
And another one is called as Varanadi Kashaya. You see, when you use these medicines, that's why I told, the patient has to undergo some patyas. Patyas means some regimens are there. You can't just, it is not advised to undergo normal daily regimen when the patient is intended to undergo this obesity treatment, because these medicines when they are taken, the patient has to undergo complete rest, has to maintain some dietary regimens, otherwise it can have adverse effects also.
Okay.
And then these are some internal medicines, and apart from that, externally we have a treatment called as Udvartana.
Okay.
Udvartana, in which we use a medicated powder to rub over the body.
So it's just like
it is a 40-45 minutes procedure that is called as Udvartana. I believe the same treatment protocol is having in Siddha also.
So, celebrate your progress, learn from your setbacks, and keep moving forward.